Welcome back to the Dr. Paul Child Health and Wellness Program. Dr. Paul, can you tell us what some of the modern issues are that are challenging children and their families today?
That's a very good question. Actually, modern times bring modern problems. Aside from the regular problems that we see, ear infections, asthma, allergies, nutritional problems, etc., we're seeing more and more behavior problems in children. And a lot of these behavior problems come from the fact that we're looking at a different society today. We're looking at, for example, unfortunately, in one of my jobs, which I hate doing as a pediatrician, is trying to identify children that are abused by their parents. Child abuse and child neglect, sometimes to tragic proportions, is what we have to deal with as pediatricians. And that is a very unfortunate thing that we have to teach our residents and our students, and we have to look out for. We have to be vigilant as pediatricians to look out for. We have to be detectives, as a matter of fact, and question every bruise and every scar that we see on a child. 50 years ago, I think child abuse was around, but I think it was less common. That is a very tragic part of what we have to do. Other issues that we're looking at, believe it or not, child poverty, and I'm talking about North American society. Child poverty, children not having access to medical care, and the inherent risks that brings. So that is an unfortunate part of what we're seeing today. Again, reflecting a new society, adoptive children, foster children in foster homes. These children are brought up in different family structures. We're being used to looking at monoparental families, single-parent families. These people are living under the poverty line. These children are at higher risk for getting ill and getting other conditions. So we're looking at all these things that are being brought on. Other things that are, again, secondary to these, I guess, changing or shifting family dynamics and family values that we're seeing are increased number of children being diagnosed with behavior problems at school. We're seeing an increased use of medications for hyperactivity. A lot of children are being diagnosed, and in some cases misdiagnosed, of being hyper because they're acting out, they're violent, they're not listening. But a lot of these children, if you really look at the situation, they're acting out because they're angry. They're acting out because their parents have been divorced. They're acting out because they've been abused themselves. So we're looking at a lot of these issues that are causing these children to react, and increasing them, their desperation. They're going to get involved in drugs. We're seeing younger children get involved in drugs. We're seeing younger children leave home. We're seeing runaways. We're seeing child prostitution because of a lot of people taking advantage of these things. So unfortunately, there's a dark side of children today, which again is a reflection, I believe, of society and society changes. Which as a pediatrician, what we have to do is be aware that these things exist and be able to screen out which children are at risk. Is this child at risk for having problems? We pay special attention to the fact that a child has gone through a recent divorce or a trauma or a psychological trauma. Children come into us today with chronic conditions, headaches and stomach pains. And we've got to think. We've got to put it as an automatic way of our thinking in our head or our mindset that yes, it could be this medical problem, that medical problem, that medical problem. But is this child stressed? Is this child being abused? Is that why he's always missing school? Is that why he or she's always complaining of a headache or abdominal pain all the time? So we're looking at these children coming out with psychosomatic diseases, in other words, diseases that are brought on by stress, and we're seeing that in young children. We're seeing it even in preschool age children as well, but by and far it's the children who are 8, 9, and 10 and over that are suffering this more. And this is an unfortunate part of what we're doing in pediatrics today.
So Dr. Paul, can you summarize what we've discussed so far today?
Yes. The first thing I wanted to tell parents is that children grow and develop very quickly, especially during the first few years of life. Following the growth and development through checkups is very important, as well as making sure your child is vaccinated. In addition, you should use your doctor or pediatrician as a resource and source of information and prevention. Prevention is best. Finally, I think you should learn as much as you can. As we said, knowledge is comfort when it comes to your child's health and wellness, and especially in today's society where we have all these modern problems, We also have a lot of modern ways of finding information. Take advantage of those. Knowledge is comfort.
Thank you, Dr. Paul. Coming up next on the Dr. Paul Child Health and Wellness Program, we delve into your questions with Dr. Paul's Mailbag next.